Hi there, I'm Emily Goldberg, a genetic counselor with JScreen. Today we're talking about something that comes up when families have a history of colorectal or endometrial cancer. How do you test for Lynch syndrome? Lynch syndrome testing is widely available and relatively straightforward, but let me walk you through how it actually works. Genetic testing using either a blood or saliva sample looks directly at your DNA and examines the specific genes associated with Lynch syndrome: MLH1, MSH2, MSH6, PMS2, and EPCAM. Identifying a mutation in one of these genes confirms a diagnosis of Lynch syndrome. For some individuals diagnosed with colorectal or endometrial cancer, tumor testing can identify characteristics of Lynch syndrome, which can then guide us towards confirmatory genetic testing. So who should consider Lynch syndrome testing? If you have a personal or family history of colorectal or endometrial cancer diagnosed before age 50, that's a strong indicator. Lynch syndrome also increases the risk for other gastrointestinal cancers and ovarian cancer. Multiple primary cancers, like a personal history of having been diagnosed with both colorectal and endometrial cancer, is another red flag. Genetic testing can be performed on a blood or saliva sample, and results are typically returned within 2 to 3 weeks. If a mutation is found and confirms a diagnosis of Lynch syndrome, we'll discuss increased screening recommendations for you and testing options for your family members. If no mutation is found, it doesn't rule out increased risk of cancers associated with Lynch syndrome, but it does mean you would be evaluated based on your own personal and family history of cancer. Testing positive for Lynch syndrome isn't necessarily something to fear. Testing can provide valuable information that can be life-saving. It means you can begin screening earlier and do it more often. With more frequent screening, you can potentially catch cancer when it's most treatable. There are also interventions that may be available to patients with Lynch syndrome that can help prevent cancer entirely. The key is working with a genetic counselor who can help you understand whether testing is right for you, explain the results, and guide you through next steps. If you're concerned about Lynch syndrome or have a family history that raises questions, visit jscreen.org.